Welcome to the Hypnosis NGH podcast. This podcast series offers a fun and serious look at hypnosis and offers various ideas, discuss case studies, along with NGH educational opportunities. Hello, and welcome to the Hypnosis NGH podcast. I'm Eric Damon with the National Guild of Hypnotists. Thank you for joining us today and our review of the upcoming Complementary Medical Hypnotism Certification course happening on March 23rd and 24th. That course is going to be online. Please welcome Scot Giles, board certified diplomat and certified instructor with the National Guild of Hypnotists and a member of the Order of Braid. Scot is also a member of the advisory board of the NGH. Dr. Giles makes his living as a working consulting hypnotist in Chicago, where he specializes in working with patients who have life-changing medical conditions, and is the author of the National Guild of Hypnotists Specialty Certification in Medical Hypnotism. So you're going to be presenting the Complementary Medical Hypnotism Certification course, and that's going to be March 23rd and 24th. And the great thing is it's going to be online for people. Before we go into that with you, Scot, I'd like you to see if you could share some general background information about yourself so everyone knows the history of Scot Giles.
Well, sure. Okay. Well, I've been interested in hypnosis from the time I was 10 years old and got into a tremendous amount of trouble hypnotizing my schoolmates and ended up getting myself thrown out of school. And my parents forbade me to have anything further to do with hypnotism. So you see how well that worked. When I went to the University of Chicago for my doctoral degree, I had the opportunity to study hypnotism in a formal setting. And found that my lifelong love of it really was justified. I liked doing it. I graduated to become a parish minister, but I immediately began to involve some hypnosis in my pastoral counseling. And I would take a 2-year postdoctoral program with Associated Mental Health Services in Chicago, affiliated with Rush Medical Center. In advanced hypnotic techniques. So that's where I come from. I'm trained basically in the Ericksonian tradition. My instructors were on the whole students of Milton Erickson and knew him personally. I've also had, this is relevant for the medical curriculum, I've also had a long time interest in mindfulness meditation. I studied it under a spiritual director who was a Buddhist monk, what's called Vipassana meditation, under a Franciscan priest for 12 years, in fact, studying the Western form of mindfulness called centering prayer, and then the more recent work of John Kabat-Zinn. So what I'm doing right now is kind of merging mindfulness meditation with hypnosis, and that will be reflected in the complementary medical curriculum. I'll talk about that when we get to it. But I've been practicing here in Chicagoland for over 35 years. I have a full-time practice in medical hypnosis. My work has a strong emphasis on working with cancer patients. I have worked with the University of Chicago Medical Center, Edward Hospital, Little Company of Mary Hospital, Greenwich Memorial Hospital, and with Wellness House at Hinsdale, which is a major cancer support center here in Chicago and the recipient of several governor's grants. So I've been doing hypnotic work with people who are living with cancer now for decades and decades, and doing so in a way that has been accepted by the medical community. For 30 years at LaGrange Memorial Hospital, I ran the ICANN program, which was the first medically approved hospital-based program in America for the hypnotic intervention into cancer, using hypnosis as a deliberate adjunct to cancer care, in addition to chemotherapy, surgery, immune therapy, radiation, and so on. And because we were in one location for 30 years, we could track our participants over a period of time. And so we know that our people did about twice as well as they would be expected to do when their outcomes were compared to the National Cancer Outcomes Database. I published my results from that program as my fellow paper for board certification with the National Guild of Hypnotists, and that's actually up on my website if anyone wants to take a look at it. So I've been working with the medical community a long time. And I believe that hypnosis is an invaluable adjunct to conventional medical care and makes the care received from the physician much more effective. And so that's what my work has been about all these many years. Now, unfortunately, in hypnotism, we've seen some people make very extreme claims like, you can cure cancer with one hypnotic induction, that kind of stuff. That kind of talk gives us all a black eye because the medical community knows it isn't true. They actually do research, they track over time, they know what the outcomes actually are. And so some of the hypnotists who say that sort of thing they're sincere, but there's something called the confirmation bias, which is what in the scientific method you work to screen out, which is that we tend to remember the things we agree with and we tend to forget the things we don't agree with. You'll talk to people and they'll say, well, I've had success stories. Well, yeah, okay, but the people on the south side of Chicago who think they can predict lottery numbers by looking at spots in chicken livers, they have success stories. That doesn't matter. What matters is the sum total of results taken over time, your successes and your failures, and you look at your success rate. And that's what I'm all about. And that's the basis of the complementary medical certification that we do in the guild.
So, I mean, all of your time has been in Chicago?
Yeah, I came out here for my doctoral degree, fell in love with the Midwest, and decided that Chicago is indeed the center of the universe, and I have been here ever since. And as my cemetery plots are here, I'm going to be here forever.
You've already have your piece of the piece of the rock, as it were, right? So now you're very active in the National Guild of Hypnotists, and you've been the NGH legislative liaison, along with developing the new PAR system, prevention, awareness, and response.
That's correct.
Um, and it was designed to help members with ethical and safe practice.
Yeah, to steer your practice into safe waters. And part of that comes out of my work with the medical community.
Yeah.
If you're going to do medical or complementary medical hypnosis, you are entering the arena of hypnotic work that is the most regulated
Yes.
and the most litigious. The medical societies will be right on your case if you're practicing medicine without a license. And if there's litigation and in the medical community, people sue at the drop of a hat, you have to always be running your practice in a way that is professionally safe, so that if you get caught up in malpractice litigation, you can defend yourself. And you can get caught up. It's happened to me twice, not because I did anything wrong, but when a person sues their hospital, they also sue everyone in the chain of care.
Yeah. That's
So if I had worked with a person, even if my work was fine and successful and good and helpful, I'm still going to get subpoenaed. And then I have to go before a judge and ask to have myself separated from that, which I've been able to do both times. But because I run my practice in a professional way with professional records, and I'm careful about what I say, and I'm careful about the claims I make. And that's why I got interested in legislation, regulation, safe practice.
Well, there's no doubt. I mean, for the NGH, you do an incredible amount of work on that, and I know members talk to us all the time, and tell us that it's great that you're on board, and heading that, and we definitely appreciate that because it is a lot of work that you.
Well, I'll accept that stroke. Thank you very much.
Well, now let's get into the course that you're going to be doing. It's
Sure.
a Complementary Medical Hypnotism Certification course. It's going to be on March 23rd and 24th over a weekend. Going to be happening online. And if you can just kind of give us an outline of what people can expect if they're thinking about taking this course.
Uh, well, first, if you're a complete beginner in hypnosis, hold off on taking this course. We don't spend any time in how to hypnotize, how to death test. You're supposed to know that before you get to a course like this. But if you know your basics, then we're going to help you improve them and also add additional arenas of skill. We've been doing this course now, it's got to be what, 25 years? Different forms.
Yeah.
We're currently in version 5. I keep improving it. And the first thing we cover is the theory of medical hypnosis. If you're going to talk to the medical community, they will expect you to be able to explain how hypnosis works in the body's neurology, what areas of the brain are involved, how does suggestion work with the nervous system. We cover that. Now, we're not going to give you a university level course in it, obviously. It's just going to be kind of once over lightly, but you're going to be able to hold an intelligent conversation with a medical professional about the neurobiology of hypnotism.
So that's definitely, you would say, that's the learning curve or whatever you want to say, that they have to be able to communicate
Yeah,
professionally with the medical
because the medical professionals talk in terms of how the body works. You
community.
want to talk to the medical professionals, you got to be talking in terms of how the body works.
Yeah, that makes sense.
The next thing we talk about is a general model for practice. This comes out of the work of two well-known psychiatrists, both of whom are medical hypnotists, Doctors Herbert and David Spiegel. And Herbert was practiced in Manhattan for years. He was actually the hypnotist in the popular book, The Symbol. And his son, sorry, David Spiegel, is at Stanford University Medical Center. Um, the model they have of how the hypnotic encounter occurs is something you can structure your whole practice around, and we teach how to do that. It is one of the most important components of the curriculum because it shows the hypnotist how you present yourself to your clientele. And that implies also how you're going to advertise and design your office and so on. Then in version 5, we have a new section called medical meditation. Currently in healthcare, there has been a real acceptance of mindfulness meditation as an adjunct to medical care, especially with chronic conditions. And for cancer is increasingly recognized as a chronic condition. So we take the material from the mindfulness-based stress management program at the University of Massachusetts Medical Center, created by psychologist John Kabat-Zinn. And this is the model being used in hospitals all over the country. We teach hypnotists about this model. If you want to study it further and take the training, you can do that with Dr. Zinn. But we're going to teach you the basics of how to help someone be mindful. And then we get to hypnosis. Now, mindfulness and hypnosis are related, but they're different. The purpose of doing mindfulness meditation is to experience the meditative state.
Right.
The purpose of doing hypnosis is because there's a goal you want to achieve: weight management, stress management, soaking cessation, pain management, and so on. Well, Michael Yapko, who is one of the best known Ericksonian hypnotists, author of the textbook Trance Work, has published a book called Guided Mindful. He calls it actually Ericksonian hypnosis, he thinks, is really guided mindfulness meditation. And his book, Mindfulness and Hypnosis, The Power of Suggestion to Transform Experience, is where we get the unification of hypnotism and mindfulness. And we're going to teach people how to do that. So it's a twofer. You're going to be able to teach mindfulness to your client with all the medical benefits that come with that, but also use your hypnotic training to make that even more effective. So if you've got a psychologist in your area who's teaching mindfulness, you're going to cover all that material too, but you're going to be able to add something to it the psychologist can't, the hypnotic
Right.
component.
Right.
So that's then other things in the curriculum are what you will integrate into your hypnotic script building. That's the use of imagery and metaphor, something called restructuring. We talk about professionalism and strategy and working with the medical community. We have a whole section on marketing because you have to know how to do that. Um, and uh, and then there's a section on transformational hypnotism, using technique, the Spigelian eye roll, as a way of really understanding the deeper personality of your client. So that even after the medical issue is resolved, the client still wants to keep working with you as a way of deepening and enhancing their personal life. And I've got clients who have been with me for hundreds of sessions over many years. The medical problem is resolved, but they're getting so much out of the hypnotic transformation. Their whole life is pulling together, their occupation's doing better, their relationships are better. They don't want to stop.
So this is a building block that can definitely help,
Absolutely.
hypnotists help them with their practice.
Absolutely. And then finally we give a selection of scripts for use. So that's the curriculum.
Nice. Now, what would be an example that you've done where you've done this in a medical setting? You know, that you have helped with a patient uh, in a medical setting. Just a short little.
Oh, routinely. Well, like, for example, in the I Can program, we met every single week, every Monday evening, and we met in a group format, and we did a group hypnotic experience with participants who were referred into the program by their physician, and they were interviewed beforehand, so I knew what their issues were: immune function, pain. Um, Emotional resilience, that sort of stuff. And I created the hypnotic experience to enhance that. But over and above that, I would often get individual referrals for specific work with specific clients. One of the more common referrals come in for clients facing surgery. There is excellent evidence. You can pull down the research from the National Institutes of Health website about hypnosis prior to surgery having a dramatic improvement in outcome, uh, less pain, faster healing, minimizing scarring. And we do hypnotic, pre-surgical hypnotic inductions here all the time.
Yeah.
And, especially for cancer surgery, where, in some cases we're doing mastectomies or other sorts of things, there's going to be scarring. And anything we can do that minimizes the keloid scarring to help produces a dramatically improved aesthetic outcome. And so that's a big chunk of what we do as well.
And the
Uh,
responses that you've had from the medical community have been positive. I mean,
well, that's why that's why all those hospitals I listed as asked me to run programs in them.
yeah, yeah.
They didn't do that because they thought it didn't work. I mean,
No,
they
no.
could they could see the results. And at this point in my practice, really just runs on physician and client referrals. Um, we have a number of physicians, in fact, who I work with for a very long time, who are a steady source of referrals now.
That's a good thing.
It is.
So why would a consulting hypnotist, I mean, this is definitely the certification that's going to bring their practice to a different level or a different setting. Is that what you would say to somebody who's saying, "Yeah, I'm thinking about taking this"?
Yeah. Well, it's going to improve your hypnotic practice, even if you never work with medical patients, because just simply getting that model that comes from Herbert and David Spiegel, that's going to help you design your practice to be effective for no matter what you're doing. The issues about safe and lawful practice and professional boundaries, that's going to help you stay out of trouble. Um, but the reason to add complementary medical hypnosis, well, first it's a profit center. I mean, everyone gets sick. Not everyone smokes, not everyone needs to lose weight, but everyone gets sick. So there's a population out there, potential clients for your practice that you can then reach out to and market to. We show you how to do that. So that would there's a simply expand your practice, expand your client base is a chunk of that, and it's going to bring you into touch with other helping professionals. You're going to get to know the doctors, the nurses, the nurse practitioners, the physician assistants, the clergy, the social workers, the psychologists, and that as you develop those relationships, they become part of your referral funnel. Um, like I have a number of psychologists who uh, their patients have been diagnosed with cancer, and uh, as an adjunct to the psychotherapy done by the psychologist, they'll send them to me for complementary medical hypnosis to control worry, to enhance physiological resilience. And then you develop a close relationship with a psychological practice that also becomes a referral source and enhances your standing in your community and your word of mouth.
Well, that makes sense. Now, somebody taking the course is definitely going to have that ability. It's not just a lecture type of course. I mean, they're going to have the ability to interact with you and
Mhm.
just to make
You
sure
know,
they
this is
understand everything. That's
we've done the course online before during the pandemic, so we're just making that,
Yep.
expanding that. But yeah, it's done in real time. It's not a pre-recorded thing, so they can ask questions and get specific feedback. And we're going to be doing some breakout groups and that sort of thing as well. I'm just very, very grateful to the National Guild of Hypnotists for having helped me create this program and for supporting it over all these years. It has become something very central to my work and to my long-term full-time hypnosis practice. And I don't know as I would ever have sat down and formalized all of this if I didn't have a reason to do so. And the Guild gave me that reason when they asked me to create this curriculum.
Well, you have a wealth of knowledge that people definitely would like to tap into, and this is definitely one of those courses. So it's the Complementary Medical Hypnotism Certification course happening March 23rd and 24th. Should sign up quickly. I'd like to thank you for taking the time to talk to us on our podcast about this,
Well,
and we'll definitely drag you back because we want the legislative side of something here that you can keep everyone informed about.
indeed. Glad to be here. Thank you for including me.
Well, thank you for joining us today on the Hypnosis NGH podcast. We hope that you definitely subscribe to our podcast and keep tuned with everything going on. If you're interested in taking the Complementary Medical Hypnotism Certification course, which is happening on March 23rd and 24th, it's an online certification course. It's pretty simple. You can log on to www.ngh.net and you can click on the Complementary Medical Hypnotism Certification course icon there and sign up online. Or you can certainly give us a call and do it over the phone, and that's at 603 429 9438. Thank you for listening to the Hypnosis NGH podcast. You're welcome to share your ideas for future podcasts by emailing us, nghpodcast@ngh.net.